Okay, our next speaker is Dr. Sarah Hecht. She's a psychologist with the weight treatment department here at McConnell. In addition to providing individual behavioral health support, she also conducts pre-surgical psychological evaluations. She teaches our monthly medical weight classes, topics such as goal setting, stress management, and emotional eating. Dr. Hecht specializes in addressing the impact of societal body shaming and weight stigma and helps patients cultivate self compassion and improve their body image and confidence throughout their health journey. She completed her doctorate in clinical psychology from Midwestern University, where she learned the importance of the collaborative approach to care, working closely with other healthcare professionals to provide personalized support. The emphasis on collaboration has informed her approach to weight management, where she works very closely with dietitians, physicians, and exercise physiologists to provide comprehensive care to patients in the program. Her postdoctoral residency was at Matrix Psychological Services, which further refined her person centered approach and her understanding of the multifaceted nature of behavior change. Her knowledge of behavior change, along with her empathetic approach, allows patients to build insight about their health behaviors and develop manageable goals and strategies to address these barriers. Her topic today is around managing burnout. For the time of diagnosis, balancing the nutrition, the exercise, the blood glucose levels, while addressing other health concerns as a full-time job. It's not uncommon for patients with diabetes to experience burnout due to balancing the daily act. The goal of this presentation is to help people learn practical strategies that you can use to overcome the challenges of diabetes management, identify potential causes of burnout, and regain motivation for self-care. So welcome, Dr. Hecht.
Maybe you want to yours, I'm sorry. It's not, it's supposed to be a preview, but it's not.
Yeah, if you do that setting,
Right here?
yeah. What does it say? Yeah. And then they like show a presenter view.
Okay, it has it, so you should be able to get your notes, right? We have that clicked on. You presenter view. Yeah.
Can I?
Go ahead.
Yeah. I can like just read the notes this way then.
Okay.
Yeah,
Are you good?
I think so.
Alright.
Yeah.
Thanks, Doc.
All right. Hello, everyone. Glad to be here. I'm Dr. Hecht, or now I'm lovingly referred to as that smelly lady with the table if you were walking around the forum today. So today we're talking about managing diabetes burnout. Ooh. Okay, sorry. AV person. Do I click the little... No, I'm lost. On the laptop? The green guy. Yeah. Yeah, it didn't do, yeah. It's just not going to the next slide.
We're going to go ahead and close it down and start it over. Because
Okay.
I think there's...
All else
Then
fails,
type
plug
of-
it in, plug it out.
Exactly.
Did you turn it on? Turn it on.
Every
Yeah.
AV guy with assault will tell you to try turning it off and turning it back on again. There we go.
Okay. Yeah, now I got notes. Yeah.
Yep, try your big green button.
Okay, that's it.
Red button brings it back.
Yep. Thank you.
Thank you, Doc.
All right. Technical difficulties, but we've got it, okay? Today we're going to define and understand the symptoms of burnout, if that's a new word for you that you've not heard with diabetes management. We're going to discuss the causes, which I think is really important of like where this comes from, how the psychology is impacted. And then the best part, right? What are we going to do about it? We're going to break that down into barriers, motivation, and self-talk. I want to start off with phone games, my dad's favorite thing. You can find him playing Candy Crush anywhere, everywhere, right? He just keeps going back to it over and over and over. Why, right? Why are these phone games so interesting? When you win something, the reward is right away, right? And pretty little colors come up, right? And it's in easy access. It's something very understandable. Now, what if I change the rules on my dad, right? The rules change periodically, not winning every time. He had to learn it a new way each time. The rewards were hit or miss, even if he did play the game absolutely perfectly. And what if I had a friend look over his shoulder and tell him and give him advice about how to play the game better, right? Diabetes, obviously not a game, but motivation decreases with all of those factors, right? You don't want to play something that you don't win all the time, that you don't get to see the benefits and the rewards of. So today we're going to talk about, how that creates distress and how that impacts our ability to take care of ourselves. So to understand burnout, we first need to understand what diabetes distress is. It's the emotional response to living with diabetes. There's so many factors into understanding how to take care of diabetes in terms of self-management, the worries and complications of the future, the social impact, maybe there's stigma or discrimination or lack of understanding, and the financial burden for some of us, right? Managing diabetes is this 24/7 care activity. There's not a whole lot else in life that we have to be this on top of all of the time. And it can cause a great deal of distress. And those little stressors of taking care of things kind of accumulate and then lead to what we're talking about, which is burnout. Okay? It's a state or emotion, a physical or emotional exhaustion caused by continuous distress of diabetes. So you start with a distress, right? Maybe there's one factor of your diabetes that's really frustrating you, and then we're moving into burnout, where I've just taken my hands off the wheel and I just don't want to do this anymore. I've lost that motivation. Individuals might realize the importance of diabetes care, but feel paralyzed or overwhelmed to do anything about it, right? And I think that's a really valid point, because I think a lot of us may look at ourselves and say, well, I'm just not disciplined enough, or I'm just lazy, right? I've never met a patient who's lazy. I actually don't think laziness exists, right? There are so many factors in our life that impact our ability to address the things that we want to at the same consistency each time. So it'll cause us to withdraw. It can be incredibly disappointing and frustrating. Despite your best efforts, your control of your blood sugars are unpredictable and feel like they're elusive, right? You did the same thing and all the good things that you did yesterday, and you're doing it today. Why am I at a low, right? And it can be frustrating of, why is this happening? We are humans, right? We love if we put effort towards something that we get to see the rewards. And especially in today's day and age, back to the phone game, we want to see those immediate results. If I'm doing the right things, why shouldn't this go the right way? Okay. So signs of diabetes burnout. You're going to feel overwhelmed, defeated, maybe powerless. You're going to feel detached from diabetes care. Maybe you're just put those blinders on. You're in denial that this really affects me. You might feel angry at your diabetes and have strong emotions towards diabetes. Quite frankly, of course you should be, right? But when that anger takes over and you don't want to engage with self-care, that's when it's not in a great place. I'm a big proponent of let those emotions fly, let them out. That's important, okay? Feeling diabetes is controlling your life, right? That resistance of like, why do I have to do this? No one else has to do this in their life and take this. I can't go to my favorite party without worrying about a low or a high, or I can't exercise the way I want to. It's controlling me, right? And we have to learn to take that power back. Being self-critical of your diabetes management, which we'll dive deeper into, how you feel towards those numbers when you see your monitoring. Feeling unmotivated and avoiding, not taking your medications, not monitoring your blood sugars, not scheduling appointments with your providers, exercising, and eating habits. you minimize the long-term effects of diabetes, right? Maybe feeling like when you're initially diagnosed, potentially of like, I got this, like all of those long-term complications are for other people. It's not going to affect me. And you're not really thinking about day to day. It's accumulating the things that you're not taking care of. Maybe risk-taking behaviors, things that you shouldn't be engaging in that aren't safe when you have like a low. And feeling alone and isolated is a big proponent, right? You don't have to check a mark all of these to have diabetes burnout. You can have some of these. And if this is resonating for you as I'm talking, you're like, oh no, Dr. Hecht is talking about me. Mark that, right? Come back to it and like pull a couple of strategies that I'm going to talk about today. So causes of burnout, they can be labeled into 3 different categories. We have barriers, motivation, and self-talk. I'm going to break those 3 down for you. Barriers. We can have personal barriers, something like mental health, right? If you have diabetes is comorbid with eating disorders and sometimes ADHD, as well as depression. And if you don't have those organization skills, if depression is really impacting your ability to feel motivated and you're really involved in that, it can really be a barrier to you addressing burnout. Your coping style. Are you a problem solver? You know, if I give you a situation, do you think about all the solutions? Or are you a person that expresses emotions and gets really wrapped up in it? Your knowledge about diabetes is inaccurate, or you don't have enough knowledge. That can be such a barrier. You think, I've seen sometimes patients, when they're first diagnosed, the doctor says, yep, you have reached the diabetic threshold, and here's a bunch of information and pamphlets, go well on your way. But not really understanding what it is and how to really treat for your body. And then you start going on Mayo Clinic or on the interwebs or telling you all of these maybe inaccurate things, right? And our perfectionist people, anyone who says, I'm going to be so self-disciplined, I'm going to exercise at this time, I'm going to take my medication this time, and you do one little slip up and you're getting really mad at yourself, right? That can be a major barrier. We have environmental stressors, you know, thinking about being a parent, having childcare, having a job that's demanding, maybe taking care of an elderly family member, a lot of external stressors, time management, being able to prioritize what's important at any given time, and being able to check your blood sugars at a consistent time, and then you're like, oh, I'm going to do that, and then you forget, right, and you move on with your day. Finances. You know, this is a tricky one. I only have one slide to support y'all on this because diabetic supplies can get quite expensive, and there's not a lot of support in this area, right? And that can be really frustrating. And then we have interpersonal, can also be some barriers. If you have conflict with your loved ones or your supports, you know, navigating those relationships, particularly if it's right and directly in your home, can distract you and move you away from wanting to take care of yourself because you're dealing with what's going on with your partnership, right? Support issues, you might have over support, someone who's kind of what I would call a diabetes police, right? They're checking everything that you're doing. Or under support, someone who is saying, oh, well, like you can have that Pepsi, that's totally fine, I don't care. And they're not really helping you on your journey. And those people out there who care for others more than you care for self, I think those people think that they're doing something by helping others, and that's very kind, but what's that saying on the airplane? You have to put your mask on before the other person's to be helpful to them. And physician trust, a big one. You need to be able to get along and feel trustworthy and confident in the providers in how they're treating you, right? Our next cause would be motivation, okay? When you're first diagnosed, I often find a lot of patients are really energized. They're like, I've got this. I'm going to take my A1C down. I'm going to do all the right things. And that motivation's really high. But then it starts to gradually decline. And it's declining because your motivation has changed. The long-term effects of the rewards that you get from managing your diabetes takes too long to see some of those benefits sometimes. So then you kind of roll back. We're eating a lot of carbs and we're not doing the exercising, right? And I want to point out, though, that this is normal. Motivation is supposed to wax and wane. When we're asking you to do a totally new habit, it's going to take time to integrate into your life, okay? Recognizing when your motivation needs boosting is the best way to notice how to take care of that wellness. So if you see you're backtracking, come back to Dr. Hecht's presentation and think, okay, where is my motivation lacking? Where can I intervene? When it comes to motivation, there are internal motivators and there's external motivators. On the extrinsic motivation side, those can be quite motivating. In the beginning, like I said, there's this push to take care of your diabetes because it's pushed by fear. Fear can be a great motivator, but it's not long lasting, unfortunately. And that's not great. That's not something you're going to connect with long term. What research has shown is that we connect better to intrinsic things, our values and mastery and purpose of being able to address diabetes, right? And some people might say, I just want to fix my health. That's a little too vague of a value. And we're going to make that more specific down the line in some future slides here. And next, the last cause is our self-talk. So much of our diabetes care is what we're doing and what we're saying in our judgments in our brain. So when we make a poor choice, we make a mistake, we have a lapse, as we would call it here. How do we view that lapse? Do we return to the new habit or do we return to our old habits? People who return to their new habit have optimistic self-talk. They're encouraging themselves. They see it as a temporary setback, an isolated incident, just a slip up, versus a person who returns to old habits is very pessimistic. They see it as a sign of failure. They see it as something that's wrong about themselves, that they can't control their blood sugar, right? What this really breaks down into is shame versus guilt, okay? So I want you to imagine Dr. Hecht's driving through Target and she sees a parked car and I accidentally hit the parked car, which possible that I could do, right? I can look at it two ways. I can be on the guilt side, which I see it as just a temporary lapse in my judgment. I was not thinking and I tried to make amends with the person by leaving my insurance or something like that. Or I could see it as shame. Dr. Hecht, you're so dumb. Why did you do that? You should never be driving again. You're the worst ever, right? Those words resonate, right? And that's going to encourage me to feel very shameful and not want to maybe ever drive again, kind of thing. So shame is about inward anger at yourself, and guilt is, hey, I just made an oopsie. That's okay. I'm going to move on. So take a scenario where you have a sweet treat and now your blood sugar's high, right? Are you in a place of shame about what happened, or are you in a place of guilt? How are we going to work through that? So now the good stuff. How are we addressing burnout? How do we work through this? Step one is notice the signs of burnout. You're going to have these slides in those little QR codes that are really awesome. Look through those warning signs, go back to them and start monitoring in your day. Do these burnout signs resonate with me? Step two, identify which diabetes self-care is lapsed. And if it's more than one area, choose one or the one that would cause the most impact to change that you want to address. Is that glucose monitoring? Is that medication managing? Is that nutrition? Is that exercise? Step three, be curious towards why the lapse is occurring and monitor behaviors. We're going to label, is it a barrier issue? Is it a motivation issue? Is it a self-talk issue? And then we're going to develop interventions to address what those causes might be, okay? So we're going to practice this step three rhetorically here. I'm going to walk you through it. We've got our causes up in the top corner here. So the checking my blood sugar, I'm checking the blood sugar and the number's high, makes me feel bad about myself. This is an issue with the person's self-talk, and the barrier is their coping style. They're connected to their emotions. They're not doing a problem solving and looking how we can address this, right? Which healthy meal plan should I go with? I'm overwhelmed of where to start. This is a barrier of education, right? Now we know we need to get more information about what is actual appropriate nutritional care. We need to get connected to a dietitian or our PCP. I cheated. Hold on, you didn't see that. Glucose monitoring, medications, all of it. It's a reminder that I have diabetes, and I don't want to think about it. This is a motivation issue as well. The barrier is mental health, right? It's our identity. We are not in a space of acceptance that we've got diabetes and like we really need to make some changes in our life. And so connecting with a therapist even to explore that and what diabetes means to you and your identity is important. I can sense my spouse judging me when I order pizza. Been there. Yeah, right? This barrier is interpersonal, right? We need to have some serious conversations of how we want to be supported in what we eat and how we treat our bodies. And I have no time for exercise. This is a motivation barrier. We need to do some interventions on what is causing me to not feel interested in exercising, okay? So this would be your third step in the process. Look at what your behaviors you're doing. Try to figure out what cause is occurring and try to intervene at those areas. Oh, and it's an environmental issue as well. Is there a time management issue going on, okay? So I talked about mental health. People with diabetes are 2 to 3 times more likely to have depression than people without diabetes. Diabetes does not cause depression, but it's all the stressors that occur that makes you more likely to experience depression, as well as the eating disorders, ADHD, and anxiety. So the best treatment for mental health is get connected with a therapist, right? If you've never done it, it can be a really courageous thing to do. It may be new, but let the therapist guide you and ask some open-ended questions to help support you and make changes mental health-wise. If that's not your jam, there are plenty of self-help books out there as a great start, and using in your religious or spiritual affiliations or community supports. Knowledge about diabetes, that's, get involved in your DSME programs, talk to your PCP, your endocrinologist, dietitian, go to the ADA website, get books, and get more learned in that. That's a basic fix. There's no special thing there. It's just reading, learning, getting involved. The personal barriers. We're going to start with that coping style I talked about. Coping requires stress management skills. We talked a little bit about that, of the deep breathing, mindfulness, guided imagery, things like that. If you stop by my table for the smell factor, right, we were only thinking about the smells on my table, right? We weren't thinking about what's next, what am I going to eat after this, and also that argument that happened with my spouse yesterday. We were just in the present moment thinking about our smells. That is mindfulness. That's all it is. People get really scared. I heard earlier of meditation and things like that. All it is just being in the present moment. Thoughts are going to flow and get loud. That's okay. Just let them flow and move out of your head. Writing and journaling doesn't need to be long paragraphs. You can do bullet points of what you're feeling in the moment. And then, quite frankly, if you roll back to the pandemic, what kept us all sane? It was the arts, right? Reading things, listening to things, humor, seeing TV shows that were our favorites. People got into hula hooping or crocheting, right? So exploring something that you get lost in and exploring something that's art related can be really helpful. Spending time in nature, being with friends, right? Be curious in this stress management space. Keep trying things till you find it. As my mom says, take no thank you bites. So just keep looking for things that bring you a sense of calmness. Perfectionism. So when you check the thermostat at home, do you attach self-worth to how high that number is or how low it is, right? Probably not. Although 70 is the perfect temperature, and that's the only way to do it. But really, I'm pointing out that when we look at our blood sugar numbers, we can attach an identity to, oh my gosh, it's this high, and it's because I had that donut or whatever. No, it's telling you a number, and it's telling you how to adjust it, that we need to go lower, and we need to do some interventions. It's not saying you're a bad person, right? It's just information. So we want to separate your blood sugar control from your identity and self-worth. you're not defined by those numbers or by A1C. People who have struggled with perfectionism see their failures and mistakes as reflections on themselves, when that's just not the case. So we need to learn to release ourselves from the self-blame and recognize that literally no one is perfect at anything, right? Everyone makes mistakes along the way. And nutritional and exercise changes, what I have found, it's people doing it consistently most of the time, not that they're perfect at it every single day. We want to, 6 out of the 7 days or 5 out of the 7 days, we're doing our walks. Awesome. That's great. Okay. The environmental barriers. We need to take inventory of areas of our life that are causing us stress. Is it childcare? Is it career? Is it lack of transportation? And we need to then find ways to address that specifically. I suggest making a list of all the possible ways that you could address this situation, even if they're not feasible. Sometimes going to the extreme can help us come back to the middle of what is actually feasible for our world. And then it's very important for you to advocate for yourself, letting, if you feel comfortable, your boss know, hey, I'm going to have a low sometimes and I got to go take care of myself, and setting those boundaries and prioritizing your needs when that occurs. Time management. I'm a big visual cues. If it's not written down, it's not getting done, okay? So have calendars, have tracking apps, have checklists, things that you can see. I've asked patients to put notes like at the dinner table or on their fridge that encourage them of, hey, did you check your sugars today? Or, hey, let's make good choices at the fridge today. Utilize alarms. Those are really helpful to encourage you of when to take your blood sugars. And if time is limited, making small changes in engaging in multiple tasks at once. So watching TV and using your walking pad. Maintain a list of your low-carb favorite meals, so that every time you sit down for a meal plan, you don't need to create something on the fly. Finances, like I said, this one's such a challenging one. There's just not as much support as we need and education in this world to encourage financial support in this area, and this can be such a burden to get your diabetic supplies and what you need. So talk to your PCP is my first step. See if they have information on resources to assist. Get involved in diabetic support groups, whether that's in person or virtual. Sometimes other people have different information that can be helpful. And then follow your like ADA and things like that to get latest news of like changes. Interpersonal, like the conflicts with your supports, right? Frequent arguments or stonewalling. Stonewalling is where we do that lovely thing where I'm just not going to talk to you and I'm going to be in that room, right? That isolation is no good. We need to connect and work through that conflict. So if you need mediation through a friend or professional to explore the root of what the issue is, that's a great start. Physician trust. Not all physicians are alike, right? And so a lot of great ones out there and a lot of people who need that continuing education. But if you go to your provider and you're feeling like they're finger wagging you and every time you go in there, they're just not aligning with you or making you feel bad, maybe that's not the right fit for you. And I'm a big proponent of like clinician shopping and finding who works for you, and maybe even taking a step further to go to a specialist in particular for services. Okay. There might be people who are supports of someone with diabetes, and this is the slide for you, the do's and don'ts, okay? Do take interest in your loved one's diabetic care. Don't just think it's their thing. They're going to need support along the way. Get involved. Do attend their appointments. That's great education to get involved and talk about numbers and things like that. Do have diabetic supplies with you in case of an emergency. Do ask how you can be helpful. What helpful responses do you have for a low or high blood sugar, right? If you have a loved one, every time your Dexcom goes off and they're like, well, what did you eat? That's not a great space. We need to be collaborative and have a conversation of how you really want that person to respond in the moment. Do bring awareness to mental health concerns and offer support. You're seeing your loved one really low or struggling with time management. Offer, hey, maybe we should go get extra support on this. do assist in with tasks and simplifying them. Like if they can make the grocery list and you go out and grab the groceries, that's great. That's excellent support. Divide and conquer. On the don't side, don't make critical statements about their self-care, right? No one responds to finger wagging, right? Think about your favorite coaches or friends that were encouraging and inspired you. They didn't say, well, you better do better next time. No, they said some really encouraging statements. So you need to be that same support, right? Don't ignore the disease and live in denial about it. Don't engage in the hardship Olympics, which is, well, I have it worse because blah, blah, blah is happening to me. That's not great. Everyone has struggles. We don't need to compare them. And don't offer medical advice, right? I was searching the internet and I saw this works. Leave it to the professionals, please. Yeah. In my home, I have a fiance with type 1 diabetes, and like what's really been beneficial for us is when he's changing sensors, he has this moment of, I freaking hate this. I hate that I have to do this, right? And just being there and validating his experience can be incredibly powerful to have a moment to just break down about it, okay? Other interpersonal research indicates individuals who have positive supports are 10 times, that were supposed to be times, to manage their diabetes better than living without diabetes. Supports, like I said, can assist with feeling overwhelmed, stress relief, things like that. I sometimes have patients who are like, I'm an adult. How do I make friends? How do I find supports? There's groups online. There's groups, I believe, in the Central Ohio area to join. And if you want someone who isn't a person with diabetes and you just want to hang out, join clubs, join book clubs, strike up conversations with people randomly, and then follow up with, hey, what's your phone number? Can we text sometime? That's how we build connections, right? Okay, motivation side. I'm going really fast because I know I want to get you guys out on time so we can do our Q&A. So if there's something here that I'm not reading, please go back and read it in your slides, okay? I had mentioned intrinsic values can really be the motivator, right? So a non-specific value is, I value my health. Well, that's not really helpful. We all value our health, but why do we want to address our diabetic care? What is really the reason? If we make it more specific, it might be, I value my career, and performing at my best, I need to make sure I have a lower A1C. So because of your career, because you want to perform well, that's why we're going to exercise, we're going to do nutrition, we're going to check our blood sugars, connecting to that and coming back to that. And then our goals need to be specific. I'm just going to eat right. That's overwhelming. Where do you start, right? I'm a big proponent of make small changes first. So add 1 cup of vegetables to each meal. When you're first diagnosed, there's maybe a feeling of I'm going to do all things all together. That's too many changes sometimes. Let's simplify it. Let's start with 1, master that. Let's add another one. Know the changes you have made in managing your diabetic health. Like I said, you're not going to see those long-term effects right away, but you can notice like small changes, your energy coming up, you feel less fatigued, and that should be the motivator. This is my visual of taking small steps. We don't want to we're going to get exhausted making these big leaps. We're going to do bit by bit by bit, okay? Keep your goals realistic expectations, okay? Oh, this is an interesting study. So if you've ever heard 30 days to form a habit, that's actually a myth, right? That was misinformation. Sometimes things happen with science. They recreated the study, and it actually takes 18 to 254 days to incorporate a new habit. That's the realistic piece. And so what they did is had people do small changes, like adding a piece of fruit at lunch. The average it took them to just make that little change took 66 days. Okay? So don't get hard on yourself of why can't I get this all done? It's gonna take you a long time to incorporate this in your day-to-day care. My favorite thing, self-talk. Adjusting your self-talk takes monitoring your thoughts and practice. You need to notice your negative self-talk, right? When you are checking your blood sugar, notice as well what your thoughts are doing in that moment. Is it being really negative about that process? If you are thinking about going to exercise, what comes up for you? What thoughts come up that are resistant? Try to look for a pattern and jot those patterns down, okay? Then we want to alter the self-talk, right? We want to use optimistic, encouraging statements, being uplifting. And this is different than toxic positivity. We're not going to be like, everything's sunshine and rainbows. But we want to be more like, I can do this. I've done this before. We're going to look towards the future. This is going to be okay. We can use mantras. There's lots of good ones online. Just read through mantras, see what resonates. And mantras sound like those classic, like if you first you don't succeed, try again. It might be all humans have value, things like that are feel good, that resonate with you. And write those down, put them on your phone, whatever is encouraging. We talk about reframing, and this is altering your perception to a situation. So if you promised yourself that you were going to exercise and you didn't, and you're like, well, it's because I'm lazy, right? We can reframe that to, no, I had a hard day at work, and what I need in this moment is relaxation. How are we going to make a different choice tomorrow? What's that going to look like? We can challenge unrealistic and exaggerated thoughts. And that might be, I promised myself that I was going to eat perfectly today, and I didn't. Well, challenge that thought. It's a big task, and anyone would struggle with that. So I'm going to try again differently tomorrow. This is a list of positive self-talk examples if this is a struggle for you. Oftentimes I get a lot of patients and they're like, I tried at Dr. Hecht for a day and my thinking didn't change. Yeah, no duh. It's going to take practice. It's going to take time. And quite frankly, it's going to feel weird. When we're in a space of negativity, adding something positive feels bizarre. It feels different in our bodies. But you did not grow up as an infant saying negative things. This was learned over time. And so we have to backtrack it and learn to say positive things. I did it. We're going to 11:10. Okay. So here's your homework. I said a lot of things here. So identify the areas of diabetes distress. If it's in glucose monitoring, medication, nutrition, or exercise, where are you struggling? Find that one thing. Pick one area to address and determine its cause. Like we talked about, is it a barrier? Is it a motivation? Is it a self-talk? And then pick a strategy, one today that really resonated, okay? You got a lot of pamphlets at this diabetes forum. It can be overwhelming. So a lot of us will stick it in a folder and we don't look at it ever again. Maybe put an alarm in your phone a month from now and pick one sheet out and look at it and see if there's one thing that you want to try from today. But I'm going to leave you with that. Please stay curious, stay kind, stay self-compassionate. You're all really amazing for being here. This is a great start. Thank you.